Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
On the day-to-day basis, the one thing that I have to remember, even when Gary's giving me a hard time about brushing, years later it will pay off. It is important, regardless of the person's physical or mental disability, as we might want to call it. They are entitled to do all they can with what they have, and that's what I want to see happen with Gary.
Home dental care for preschool children with handicaps. These preschool children are smiling and having fun. Their smiles show a lot about them, including their dental health. Although preschool youngsters may require more attention to home dental care, their mouths can be just as clean and healthy as any other person. You as parents can help. You can begin care when there are only a few front teeth. Wrap a small gauze or sponge around your finger and wipe your child's teeth clean. By beginning good health habits when your child is young, your child can have a healthy smile that will last a lifetime. Good dental health begins with toothbrushing. Toothbrushing removes sticky food and plaque which contribute to tooth decay and gum disease. Make sure you brush every surface of every tooth. The main goal is daily removal of plaque without injuring teeth or gums. A model toothbrushing method is shown in videotape number 2 of this series and can be adapted according to the needs and capabilities of your child. Remember that preschoolers have small mouths. It is important to have a very small toothbrush, which will not gag the child or be abrasive to the gums. Try to avoid brushing too hard, too long, or too fast in any one spot. It can be helpful to practice on another adult and then have that person practice on you when learning how to care for your child's teeth. When providing daily dental care, you as the parent or caregiver can play one of 3 roles. First, you can act as the provider, being totally responsible for brushing and flossing. This is done when the child is very young or more seriously disabled. Second, you can act as the helper, in which case both the parent and the child are responsible for some part of the procedure. You can assume this role if and when the child can be trained to use his or her limbs more effectively. Third, you can act as the supervisor. Here, the child who is older and has gained dexterity assumes responsibility for cleaning his or her teeth, while you oversee and check the process. Your goal is to have the child do as much as possible for himself. The role that you play depends on how fast the child learns and how much help the youngster needs. The role changes as the child grows.
If at all possible, it's so important to let your child be as independent as he or she can be. And one of the things with brushing the teeth, it's a thing that you can praise them and that inspires them to do better the next time.
A commitment to good oral care is critical since many children with handicaps have a greater likelihood of developing dental disease than other children. Weak muscle control, poorly formed teeth or jaws, and susceptibility to disease can contribute to dental problems. Some handicapped children have unhealthy mouths because they have poor diets or because their teeth are just too difficult to clean. However, if you provide good oral care at home, problems like toothaches, missing teeth, bad breath, and decay can be avoided. All parents of preschool children should take responsibility for toothbrushing, even though the child is encouraged to do some of it alone. It usually takes years for children to brush independently and effectively. The parents you're about to see will talk about how they provide home dental care for their preschool children. Jeff has cerebral palsy. His mother describes her role as a provider.
Jeff's 3.5, and I guess we just did his brushing as his teeth started coming in. I introduced the toothbrush, and I think at first it was more or less a toy. He chewed it, he played with it. We even had a little toothbrush that has like a bell in the handle, and they'd shake it and just kind of play with it. And at first he was really, he didn't like his face touched. So, and now he loves it. He just would, goes right for it. He's ready to go.
Jason is 4 years old and has cerebral palsy and epilepsy. His dad talks about toothbrushing in their family.
We try and make him brush his teeth every night before he goes to bed. As often as we can, we try and make a game of it with his sister, his older sister, and him in the bathroom brushing their teeth. Sometimes he runs out of the bathroom, and we chase him down wherever he might be, bathroom or living room, wherever, and try and make a game of it there. But we're real pleased with the way his teeth are so far, and we're going to continue it.
We started brushing Beth's teeth when she got teeth, and I started brushing them myself. But as she got older and realized what was really going on, and she saw her older sister brushing them, she wanted to brush them herself. And so we came up with the idea. We got a little mirror for her. We set it up on the toilet where she could stand and see herself, and gave her the brush. And she just started brushing herself. And then as she was brushing, I'd show her, I'd point, you know, brush here now, and brush here now, and brush here, and she'd brush away. And when she got done, I would then go over her teeth for her, and with her still looking in the mirror. And we do it every day, morning and night. It's pretty religiously, and she's a pretty habit person. If you miss brushing your teeth, she reminds you to brush your teeth.
We both have kind of an active life together and apart, and if Jane's not home, I take care of the kids and I brush the teeth, and if Jane puts them to bed, she brushes the teeth. You know, it's whoever's putting them to bed that particular night. You know, it's really no problem, it's just something you do.
Providing and teaching oral care is more difficult with some youngsters. Gary is 4 years old, and his mother discusses some problems she's faced.
That word autistic really frightened me. I could see just a life of head banging, and possibly when I'm dead and gone, institution after institution. And it was very sad for me. It's funny, when I first started brushing Gary's teeth, it was easy. Then it got really bad, and now things are getting easy again. And I'm hoping that they'll continue to get easier. One of the behavior problems that I found with him was that he always jerked the brush away. He would turn the water on real fast. He would do anything to get my attention away from brushing. He wanted to do it so he could eat the paste. I tried all kinds of things like reasoning with him, and that didn't work. Then I tried to, at first I could restrain him. That worked for a while, but he's so strong now it doesn't work anymore. I usually have to be very firm. Then I always promise him that if he lets me do it first, I'll give him toothpaste and he can do it the second time around. And without any supervision, he's allowed to do however he pleases with that time.
There are a variety of adaptive devices which can be useful for children who have physical problems such as limited grasp or limited range of motion. These should be used with the advice of your dentist, hygienist, or occupational therapist.
The role of the occupational therapist is to promote independence for the child so that they can be as independent as possible and do things on their own. We try to achieve this through normalization of muscle tone, the use of adaptive equipment, and several other devices and techniques. The occupational therapist anticipates having a long-term relationship with the family, starting when a child is very young, working up through adolescence and adulthood. Probably some of the most specific problems that we would see would be a problem with sensitization, the child not liking his face or oral motor area touched, and we can work on improving that.
It may be convenient for you to brush your child's teeth immediately after mealtime while the youngster is in a high chair or at the table. Brushing your child's teeth can sometimes be made easier by adjusting the position you use. Holding your child in a firm yet gentle manner provides support and comfort, especially when there are uncontrolled movements. If your child is large, somewhat uncooperative, or has excessive head movements, then seat her in a chair and stand behind her. Use one arm to cradle and support her head. If your child is uncooperative or needs support for his arms and legs, then seat him on the floor with his back to the chair. Sit in the chair and cross your legs over the youngster's shoulders. If your child is very young or in bed for a period of time, put him on the floor, bed, or couch, Then lean across him or stand by the child's head. If your child is young or moderately disabled, then place him on a couch with his head on your lap. As your child learns to accept home dental care, the need for such restraint will disappear. You can learn these techniques from your dentist or hygienist. Effective toothbrushing and regular checkups are important for good oral health, but good eating habits are also important. A nutritionist talks about this.
Parents can help build good teeth and gums by providing 3 healthy, nutritious meals based on the basic 4 food groups, by providing healthy snacks, and by providing at least 4 glasses of fluoridated water per day.
The daily food guide consists of the milk group, the meat group, fruits and vegetables, and the grain group. You should avoid foods that are high in sugar content, that stick to the teeth, are those that don't dissolve easily because such foods produce acid that causes tooth decay. Many commercially prepared foods contain a lot of sugar, so it's important to read labels and choose foods with little or no sugar added. Sometimes preschoolers refuse to eat certain foods. Allergies may also be a problem, and parents need to work with physicians and nutritionists to find adequate food substitutes or supplements. Don't allow your child to fall asleep with a bottle of milk or juice. The remains of liquids containing sugar can lead to tooth decay when left in the mouth. If needed, you can use a bottle of plain water or a pacifier recommended by your dentist or pediatrician. Though severe difficulties in sucking and swallowing may have required tube feedings or liquefied foods, you should consider progressing to more solid foods as soon as possible so that the muscles of the mouth and jaw are exercised.
With head and neck involvement, there will frequently be chewing difficulty, swallowing difficulty too. And with many of these children, I think it's important that the parent cooperate closely with the therapists at the treatment centers, because the therapist may be working with that child in helping to train the child to chew certain foods like slices of apple, very thin slices of carrot or celery are good foods to begin the training for chewing, because they have substance and crispness, and the child can feel the food. Snacks, as a rule, should be limited or eliminated. If a snack is needed, I'd rather see a snack like a toasted half a muffin with cheese, a good protein food that's going to contribute more valuable food factors to the growing child.
Doug has a lot of eating problems. He is unable to eat table foods. His foods have to all be blended, and he has a lot of trouble swallowing the food. He produces a lot of mucus constantly due to his scoliosis, and so we have to feed him frequently in small amounts, and the food always has to be blended. This is a problem for his teeth, because he doesn't get a chance to chew properly.
You can control foods that your children eat at home, but what about when they're away from home? You can try providing nutritious snacks for nursery school parties or other occasions. The best results occur when parents and school personnel work together on nutrition and daily oral care.
First of all, we don't force them to brush their teeth. We're real patient with them, and do it when they're ready. After we sit them down and everything, we don't just automatically stick a toothbrush in their mouth. We just take our time, let them see the toothbrush, let them see the toothpaste and everything. Then the thing that we find we have most success with is singing during the activity.
I'm health coordinator, one of the local Head Start programs. I'm responsible for getting the children to the dentist. We teach all the kids in the program how to brush and floss daily. As a matter of fact, a lesson plan or unit is prepared on that. The children are very receptive. They're willing to learn. I have had a workshop, a dental workshop, in teaching the parents the proper way that their children should brush and floss daily.
Combined with your work at home and school, physicians and dentists play an important role in maintaining your child's dental health. A pediatrician discusses the need for a team approach.
I think the important thing with any kid, whether they're handicapped from birth or handicapped because of an accident later or an illness later in life, is parents need to know completely what's going on. Our philosophy here is that parents and kids are part of the team.
Regular dental checkups are advised once or twice a year. Parents should prepare their child for the first visit to the dentist by telling the child what will happen. There are good children's books about visiting the dentist, or the parents can rely on their own experience when talking to the child.
We would recommend that the handicapped child, as well as the normal child, be seen by the dentist around age 3. This is the time when the primary or baby teeth have completed their development and should be erupted into the mouth and in function.
In working with any young handicapped child, it's necessary to establish a good feeling of trust and security on the part of the child so that you can accomplish the procedures that you want to easily and efficiently. First thing that we'd want to do is to secure a very adequate health history, including the medical, the dental, and the behavioral characteristics of the child as far as they're known.
How much will your child understand when the dentist explains or shows something? Can your child sit in the dental chair without help? How much control does your child have of the mouth, head, and neck? How do you get your child to cooperate?
I asked our family dentist whether or not he would look at Jeff as a patient, and he felt he was not equipped to handle him, that he wouldn't have seating facility for him, and he was not too sure on gag reflex or bite reflex and things like that, and he just, no, he didn't feel comfortable to work on him.
You may have difficulty finding the right dentist for your child. Some dentists are uncomfortable about working with a person with a handicap. Sometimes the youngster's physical or behavioral problems present such difficulties to a particular dentist that he or she cannot work effectively with the child. If you encounter such problems, contact your local dental society, nearby dental school, or parent organization, such as United Cerebral Palsy or Association for Retarded Citizens. You may find it necessary to try out several different dentists until you find one that meets your child's needs. You may be afraid of visits to the dentist office because you're not sure how your child will behave there or how others will react to your child. Therefore, you'll need to arrange office visits so that your child will be the most cooperative.
As you come into the office, please do not be embarrassed in relation to other families who may be waiting. We, in our office, intend to see the handicapped child on regular appointments, just like we do all the other patients who come to our office. We in the dental profession are here to help you, the parent of the handicapped child, the best way possible, presumably with the emphasis on prevention rather than on treatment.
One of the ways a dentist can be helpful is in the management of medication. You should ask about the possible side effects of all medications that are prescribed for your child, since some medications affect the condition of the mouth, gums, and teeth. As the parent of a young child with handicaps, you have many responsibilities concerning health care. Some of your child's problems are difficult to solve. However, good oral care at home is one area in which you can make an important impact. This can mean fewer medical and dental bills, a more pleasant appearance, fewer chewing and speech problems, and greater social acceptance.
We've been told, because of Down syndromes usually have periodontal disease and they lose teeth early in life due to lack of good dental hygiene. And we've been really conscientious of our dental hygiene, so we haven't had any of those problems yet.
It has been worth the time that I've put into doing his teeth. Sometimes I feel like, well, I could just let it go. It just isn't worth all of this. But then I remember I'm the one that really has to make that choice.
These parents provided home dental care for their children, and it paid off. Your efforts can too. Remember, brush your child's teeth at least once a day, preferably at night. Provide fluoride either in the drinking water or through supplements. Visit the dentist regularly, approximately once every 6 months. And avoid sweets. Your child can have a healthy smile that will last a lifetime.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.